Here on Why I Vaccinate, we now welcome Dr. Yaseen Rafee. He is a Michigan State University assistant professor of pediatrics. He's also a pediatric infectious disease specialist at Hurley Children's Hospital. Doctor, welcome to the show. It's really great to have you here.
Thank you. Thank you. You're welcome. Thank you. My pleasure.
And, and Veronica, I'm going to let you kick this segment off for us.
Doctor, we have so much we want to talk to you about today. Thank you for being here. I'd like to start by talking to you about everything COVID. So there's a lot that parents are concerned about. They want to know what you're seeing in the hospital system, especially since school is now back in person. Can you talk to us about your experience right now with COVID in kids?
Sure. Recently over the last few weeks, we have seen some increase in the number of cases that test positive and number of cases that get admitted to our pediatric unit. And actually, our pediatric intensive care unit. Mainly, they're kind of teenagers with some underlying health issues, obesity, asthma. And I have seen a level like similar to what I had seen back in April last year. They're sick. Many of them require some assisted ventilation or some kind of breathing machine to help them breathe. They're sick for a few days in the hospital. So I think we see definitely a good increase in the number of cases. The other situation that I have been encountering here is increase in the number of cases of what we call it post-COVID syndrome, or the multi-inflammatory syndrome associated with COVID, meaning kids few weeks after having a COVID, they come down with fever, rash, red eyes, inflammation in the muscle of their heart. They're really sick and get admitted for that reason, which is kind of unique pediatric situation. So I've seen also increase in the number of these cases.
And can you comment on whether these cases you're seeing are happening in kids who are vaccinated or unvaccinated in that adolescent age group?
So, most of the cases that I have seen over the last, let's say, 2 months, they were unvaccinated. I don't have an exact number, but I can tell you the majority, more than 80-90%. Actually, I don't remember even a case of a young adolescent who was vaccinated and got admitted. Taking consideration, I practice in a small community hospital, so I don't have large number to comment, but that have been my personal experience here, that most were unvaccinated.
So for those parents with kids in this age group who are still on the fence about whether or not to get their kids the vaccine, what can you say to them?
Go get it. It's easy to get. I gave it to my 2 daughters, 13 and 17 years old. It's safe, it's effective, it protects them, and help them go back to school, be normal. Go get it.